10 minutes past the top of the hour, we're joined by a guest, Dr. Gray Wallace from right here in Kosciuszko. Doc, thanks for coming on this morning.
Appreciate you having me.
All right, Doc, I know the first thing we're going to ask, you put that thing out, Premier did, about you testing positive for COVID-19. How are you feeling? And kind of explain what you went through with that.
Yeah, so I tested positive on March 23rd, and for about a week there, it was kind of rough. I'm not going to lie. I had an excruciating headache, and for me, fairly significant shortness of breath. I've told a bunch of people I walked 3.5 miles. The Sunday before I got tested felt great, and Monday, when I knew I was sick, I was short of breath walking probably 40 or 50 feet. And so that was a significant change for me, and I knew I was sick as much as I'd read about the virus, and I felt like that for about a week. But then I recovered with very little medicine, and it felt great for, a month and a half now, just about. Been back at work since then.
Okay, and like you said, you're pretty active. I see you walking around town all the time, and it really affected you like that.
Yes.
And so folks that might not be as in good a shape, or maybe have some underlying health conditions, that's one of the issues with this virus, right?
Yes, it really, really, really likes the lungs and respiratory tract, and it hits it pretty hard.
Yeah. And so right now, we're seeing the coronavirus cases still coming up. Atala had been, one of the top, areas in the state. And I think, what are y'all seeing now? Is it beginning to level off, or can we expect more cases? What's it looking like?
It's leveled off some. The one thing we know for sure that works is our distancing does work. We proved that at the hospital, even though we had active cases and patients. We did not have any employees or staff for several weeks, close to a month, that tested positive, and we'd been in masks and gloves the whole time. And so we know that equipment does work. The cases are leveling off some, but you're going to continue to see positives kind of trickle in, so to say, unfortunately, I think for months, not weeks.
So you said the distancing works. How about masks? There's a big debate. Wearing a mask does this, wearing a mask does that. In Atala County, we still have to wear our mask when we go in a store somewhere. So does the mask really help out?
Yes, it really does. It spreads through. It is a respiratory virus. It spreads through contact with what's called a respiratory droplet. And so if someone coughs into a mask instead of into your face, it will keep you from getting it. So, everybody wearing a mask and keeping 6 feet apart in public does work. For sure. Okay,
so you said that's the one thing we know that does work.
We know that works.
Okay, yes. So if you want to continue to protect yourself, that's what you could do. We're speaking with Dr. Gray Wallace from right here in Kosciuszko. Doctor, what else can people do to kind of keep themselves? Things are kind of opening back up right now. Should people should they rush back out to do things? Should they still be cautious? What are some things that that we can do as we move forward?
So that's an interesting question. I think those that are elderly with pre-existing conditions, definitely over the age of 50, looking at the numbers, are at increased risk of serious side effects, serious complications of getting the virus. If you look at the numbers, those less than 50, they tend to have a milder case like me. That's not 100% true, but that's over 90% true. And so it's kind of difficult to give a blanket statement to that question. But for sure, the younger folks, we've seen a lot of mild cases in younger folks that, need to quarantine for 2 weeks, and, they don't feel great, but they heal without a whole lot of treatment. Unfortunately, those over 50 and especially 65 and 70-year-olds, they still need to distance. They still need to wear their mask. Anything you can control, don't touch your face. That does work.
And even when you say even a mild case, like you had a mild case, but you said even for a week it was rough for you to breathe, right?
So yeah, I'm considered a mild case, and even though any activity, just walking around the house, I was short of breath, and that's considered a mild case because I never required oxygen and I didn't need to go in the hospital. So I'm a mild case, even though I had significant symptoms.
Yeah. And so another thing here, people say it's it's a bad version of the flu, but you and I were talking before we went on the air. It does spread a lot easier than the flu. Is that one thing that y'all can determine?
Oh, yeah. I mean, it's having no trouble. Our flu season is typically, 6 months long? And, this thing has spread from somewhere in China. We think that the town of Wuhan in China in December to basically all over the world in a matter of 6 months. It moves significantly faster than the flu does. And having had the flu before, personally, I felt a whole lot worse with this than I did the flu. I would say this is not just a typical flu virus.
Okay. I've never had the flu. Knock on wood here. Never had coronavirus either, so I hope I keep those streaks going. But Dr. Wallace, one thing here, what's something that you would say to the folks here in Kosciuszko and Italic County as we continue to deal with this coronavirus pandemic, however long that may be? What's your message to folks here?
Be patient. It's and be nice. It's kind of weird, difficult times. We can't see, folks smiling at each other and saying hello. That there's some disconnect having masks on. But stay calm. Listen to your leaders. Please keep wearing your mask when you're out in public, especially if you're going to a place where you would be within close contact of folks. And we all want something that we can do and control. There is decent evidence that some vitamin regimens do seem to decrease the severity. It's not 100% true, but there's some decent evidence that vitamin C and vitamin D might make your case milder. There's also some kind of emerging evidence that the MMR vaccine, that is a measles, mumps, and rubella vaccine, in other countries, even in the folks over 50, tend to have less severe cases. We do need some large studies to prove that that's true, but it looks like it does provide some benefit, at least for severe cases. It doesn't prevent you from getting it, but might prevent you from needing to be in the hospital or requiring oxygen. So kind of talk to your regular doctor or regular provider. Could you get that? I think that's definitely a possibility. And we know that is a really safe vaccine. We've been giving that to kids for years, so there should be no adverse effects of getting that. So if you're over 50 and never had one, that's something to consider. But the big thing is listen to your leaders and stay calm, be patient, be nice.
But Dr. Wallace, we do really appreciate you for coming on and kind of shedding some light on this. You were scheduled to come on, I think, back in March, and then you got sick.
Yeah,
and,
I think I was supposed to come on the day the day after or 2 days after. So it's good to finally be here and be recovered for sure. So
yeah, we're definitely glad that you got recovered, and we thank you and all of the other healthcare workers here in Kosciuszko and Italic County for what y'all are doing right there on the front line. I think frontline workers is the new term that we have for that. But we appreciate that, and we appreciate you for coming on this morning.
Thanks for having me.